Ladies and gentlemen, and welcome to this episode of the Dan Dawson Show. So I'm gonna show you a trick. It's a really cool trick. Now, it's not a magic trick. You might think it's a magic trick. It's not a magic trick. It's a sleight of hand trick. I'm gonna read you an article. So today I'm gonna read you two articles. This article is from The Hill. It was written by Peter Sullivan. It says Minnesota hospitals warn they are overwhelmed in full-page ads. Minnesota hospital leaders are warning in a full-page newspaper ad that they are overwhelmed amid a COVID-19 surge and are urging the public to take action. Our emergency departments are overfilled, and we have patients in every bed in our hospitals. Right, the leaders of 9 hospital systems in the state, including the Mayo Clinic and the North Memorial Health. Wow, those are big names in the medical game. The hospitals warn that because their capacity is strained, care for non-coronavirus medical events like heart attacks is also threatened. Quote, now an ominous question looms. Will you be able to get care from your local community hospital without delay? Today, that's uncertain, end quote. They write in the ad, which is running in major newspapers across the state. Minnesota has the 3rd most per capita COVID-19 cases in the country, according to the COVID Act Now tracking site, behind New Hampshire and Rhode Island. Almost 1,800 people are in the hospital with COVID-19 in Minnesota, approaching the height of the winter peak last year, before vaccines were widely available. All these vaccine mandated tough on mask policy having blue states are having huge spikes in the coronavirus. I do not understand why. Other states are also facing strains at their medical facilities. Massachusetts hospitals, for example, are cutting back on some elective surgeries. The Minnesota hospital leaders point out that many of the hospitalizations could be prevented, given that COVID-19 hospitalizations across the country are being driven largely by the unvaccinated, which we know is not a true statement, because even the vaccinated are still getting COVID. I've told you, both my parents were vaccinated. Matter of fact, the only 2 people in my family who weren't vaccinated, who haven't gotten COVID, are me and one of my sisters. It is what it is. Every day we're seeing avoidable illness and death as a direct result of COVID-19, the ad says. How can we as a society stand by and watch people die when a simple shot could prevent a life-threatening illness, it adds. The hospital leaders call on people to get vaccinated, get their booster shots, as well as to wear their masks. As I switch over here, let me tell you a little funny story. Back when I was in the nursing field, before, I got smart enough to learn to work for myself and be able to retire or semi-retire at the youthful age of 48. We had a funny saying in the nursing field. It's like, you could always tell what meds were going to be passed out by what pens the doctors had. Meaning most of these people are on the take. That's a bullshit ad. Now, let me show you the real story behind this. Keep in mind, this is still Minnesota. Now, that article I just read was written today, not an hour ago. This one is from 4 days ago. Let's see what's really going on in Minnesota. This is from the Minnesota Post, written by Walker Ornstein. Just how bad is the staffing problem at Minnesota's long-term care facilities and hospitals? Among other things, a new survey of long-term care providers found roughly 76% are limiting admission to their facilities. Move my picture over here a little bit so I can see this. As COVID-19 cases continue to surge in Minnesota, hospitals and long-term care facilities are dealing with prolonged staffing shortages. resulting in less care for patients and financial problems for medical systems. If you've ever worked in the nursing field like I have, one thing you always know is it's always understaffed. You're always going to have, I've been working in this field, not counting my military years. I've been in the medical field since I was 18, I'm 48. But not counting my military service, 21 years in various places, you're always short-staffed. I don't care if it's a nursing home, long-term care facility, hospice facility, state, federal, it doesn't matter. You're always understaffed in the nursing field. It's just how it happens. And I think it's because a lot of the administrators don't understand what it takes to take care of one patient. To not be understaffed, you'd have to be one nurse to every patient. One nurse and one nurse's aide to every patient. That's just the only way you're going to get good care, and nobody does that. Nobody. It's impossible. So I don't blame them for not doing it because I understand it's impossible. And don't forget the great nursing shortage we had where they started to, because American nurses didn't want to get the vaccine after having, for a year and a half, treated patients with COVID and didn't want to follow the vaccine mandates. They said, hey, we'll bring in nurses from the Philippines. It's literally what they said. From the Philippines and Africa. It's like, okay, well, you get what you get. Because a lot of those nurses aren't coming over, not for what you're paying them. Governor Tim Walz has taken some steps to alleviate the issues, like activating National Guard members to help at long-term care facilities. So in this, I read National Guard members as scabs. See, nurses, they're using the National Guard now as scabs to screw over our nation's nurses. Well, we're not going to pay you extra. Well, we're not going to give you good benefits. Well, we're not going to give you the required days off. We're just going to bring in the National Guard. They're being federal scabs, basically, state scabs. Calling in federal medical teams for hospitals and approving $50 million for things like hiring and retention bonuses in the healthcare sector. Blah, 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 blah. But the National Guard thing, those guys are hostages, man, because they can't say no, then you get what? Court-martial? Come on. Bright move, Democrats, bright move. Health officials and legislators are also debating on other potential steps. The Minnesota Senate GOP has proposed a new $150 million plan for nursing home relief, and hospital representatives have argued for short-term help with things like background check requirements, while also advocating for longer-term assistance, such as loan relief for workers. Meaning they want to get rid of background checks. You know what that means? You know what that means? The 30-year-old guy who's already been convicted of rape 3 times can go work with your mother while she's laid up and unable to defend herself or say anything in her defense, or your sister or your grandmother. That's what that means. To me, that is evil. Let's continue on. On Wednesday, State Senator Jim Abeller, Republican from Anoka, convened the Senate's Human Services Reform, Finance, and Policy Committee to hear from long-term care facilities and hospitals about how they're dealing with staff problems, to ask more about the impact of current vaccine mandates and a potential requirement from the federal government. So he's hitting at the heart of the problem. This requirement, you have to have these to work here, even though it hasn't gone into effect, but they threaten companies with it. And some companies jumped up and acted. That's why I'm glad I'm in a state where our beloved Governor Abbott came out and said, no, you can't do this. If a facility tries to make you do this, call me. And you notice we're not having these problems in Texas. They're not having these problems in Florida. You're having these problems in your blue dog states. The number of open jobs in long-term care continues to grow in Minnesota, said Nicole Natson, Vice President of Strategic Initiatives for Care Providers of Minnesota, a long-term care trade group. A fall survey done by a group in a similar leading age Minnesota found an average of more than 2,000 more staff exits than hires each month, and about 15,000 openings for direct caregivers. That's huge. Quote, providers' inability to attract new staff and the burnout and exhaustion experienced from current staff, which accelerates turnover, have hampered any efforts to return to normal operations, end quote, Masson said it at the hearing Wednesday. See, this goes back past COVID. This is a healthcare issue. If you've worked in the healthcare field, if you've worked in the healthcare field, you know somebody that works in the healthcare field, send them this video. If they can tell me they're being fairly paid for what they do and what they deal with, have them message me. Have them message me. I'm sorry, you're not being fairly paid. And people are recognizing this. Why should I work $18 an hour, right? Breaking my back, having to deal with all kind of urine and feces and all kind of vomit, all kind of things, right? When I can make the same money down the road at McDonald's. Exactly. That's why people are turning away from this field. A new survey of long-term care providers found more than 76% are limiting admissions to their facilities, up from 70% in the earlier fall survey. Matson said. Now understand, this isn't a new problem. This has been a problem in the healthcare field for generations. And you're talking to a man who comes from a family who's worked in the healthcare field, a lot of us. In rural parts of the state, the problem is even worse. Matson said, more than 90% of providers there are limiting admissions. This is, quote, this is extremely unusual, end quote, Matson said in an interview Wednesday. Quote, 70% is a huge number. What's typical, I mean, less than 10%, but at any given time would be limiting admissions. We've had workforce issues in the past, nothing has ever compared to this. Maybe for his area, that's true. The area I used to work, that's not true. That's not true. We limited admissions usually, and that was a lot more than 70%. Cami Peterson DeVries, adult geriatric nurse practitioner of St. Francis Health Services of Morris, which operates mostly in rural areas and has 13 nursing homes, 10 assisted living facilities, and more than 70 group homes, told the Senate committee that some of their care centers are at 60 to 70% occupancy, and despite efforts to recruit and retain workers, made more difficult by nearby high-paying Mayo Clinic facilities. They're paying out huge amounts in bonuses and overtime to cover shifts. So you see what I'm saying? It's not a COVID problem. It's a pay and respect problem. Dude, think about it, right? Sorry. Do you really want to be wiping a stranger's ass, carrying their urine, getting them out of bed for $15 an hour, while the nurse who makes 5 times as much as you sits online in the back of a desk shopping on Amazon and then has the nerve to yell at you when you're not even getting your breaks? This isn't about COVID. This is about the shitty state of how healthcare workers, even nurses, LPNs, aides, custodial staff are treated. How they're treated and how they're paid had nothing to do with COVID. I'm not even going to read the rest of this. It's just too long. But from that, I hope you got the general idea of what I'm saying and trying to point out to you. They're using these shortages as a COVID thing. It's not a COVID thing at all. Trust me. I've worked in the healthcare field since I was for 30 years. So 18. I know the ins and outs of it. And that's why I'll never do it again. Ever. I had to become a professional gambler. This head, I probably think I could pull it off. Professional pool shooter, a pool player. Billiards player? I don't know. think I could do that. Who knows? But anyway, thank you all. Like, subscribe, share. Keep your powder dry. And as always, especially in these days and times, do what you got to do.